Hello everyone, and welcome back to our channel. Join me as I dive into the controversial topic of why you should avoid antibiotics for bronchitis. Can I convince you to change your mind? When it comes to bronchitis, there's a common misconception that swirls around the role of antibiotics in its treatment. Many of us assume that antibiotics are the go-to solution for clearing up this nasty respiratory infection. But what if I told you that's not entirely accurate? In fact, using antibiotics for bronchitis can do more harm than good, and it's essential to understand why. Antibiotics are often prescribed for bronchitis, and it's a practice that's been perpetuated for far too long. Statistics show that up to 70% of bronchitis cases are treated with antibiotics, despite the fact that most of these cases are caused by viral infections that antibiotics can't even touch. This isn't just a minor issue. It has severe consequences. The overuse of antibiotics is a significant contributor to the growing problem of antibiotic resistance. When we use antibiotics unnecessarily, we're giving bacteria the opportunity to adapt and evolve, making these life-saving drugs less effective against future infections. The root of this problem lies in the way we approach bronchitis treatment. Doctors are often under pressure to prescribe anything to their patients, even if it's not entirely warranted. And let's be honest, patients often expect to leave the doctor's office with a prescription in hand. But this pressure to prescribe can lead to reckless antibiotic use, putting patients and the broader community at risk. The consequences of this practice are far-reaching. Not only do we risk creating superbugs that are resistant to our best antibiotics, but we also expose patients to potential side effects, allergic reactions, and interactions with other medications. It's a vicious cycle that needs to be broken, and it starts with understanding the true nature of bronchitis. Bronchitis is a common respiratory condition characterized by inflammation of the bronchial tubes, which are responsible for carrying air to and from the lungs. The debate over the use of antibiotics for treating bronchitis is both complex and controversial. Many people, including patients and healthcare providers, still operate under the misconception that antibiotics are the go-to treatment for bronchitis. However, the evidence increasingly suggests otherwise. This comprehensive analysis aims to elucidate why antibiotics should generally be avoided in the treatment of bronchitis, exploring the underlying reasons, examining scientific evidence, and proposing alternative approaches to management. Understanding bronchitis. Bronchitis can be categorized into two primary types: acute and chronic. Acute bronchitis. This form is typically caused by viral infections, such as the common cold or influenza. It is characterized by a cough, production of mucus, and other symptoms similar to those of a respiratory infection. Acute bronchitis often follows a viral upper respiratory tract infection. Chronic bronchitis. This type is part of chronic obstructive pulmonary disease, COPD, and is usually caused by long-term exposure to irritants, such as cigarette smoke or environmental pollutants. Chronic bronchitis is defined by a productive cough that lasts for at least 3 months per year over a period of 2 years or more. The role of antibiotics. Antibiotics are designed to combat bacterial infections. They work by targeting specific bacterial processes or structures that are essential for bacterial survival and replication. However, their effectiveness is limited to bacterial infections and does not extend to viral infections, which are the predominant cause of acute bronchitis. Why antibiotics are often misused. Misconception of efficacy. There is a prevalent misconception that antibiotics can cure all types of infections, including viral ones. This belief is fueled by the historical use of antibiotics for various ailments and the general expectation that any prescription from a doctor should lead to improvement. Pressure to prescribe. Healthcare providers often face pressure from patients who expect a prescription to address their symptoms. This pressure, combined with a desire to provide a tangible solution, can lead to the overprescription of antibiotics. Lack of diagnostic precision. In some cases, healthcare providers may not differentiate between viral and bacterial bronchitis, leading to inappropriate antibiotic use. Consequences of antibiotic overuse. Antibiotic resistance. One of the most significant risks associated with the overuse of antibiotics is the development of antibiotic-resistant bacteria. When antibiotics are used unnecessarily, bacteria can adapt, resulting in strains that are resistant to multiple antibiotics. This resistance makes it more difficult to treat bacterial infections effectively, posing a serious public health threat. Side effects and complications. Antibiotics can have adverse effects, including allergic reactions, gastrointestinal disturbances, and interactions with other medications. Inappropriate use increases the risk of these complications without providing any real benefit to the patient. Impact on gut microbiota. Antibiotics can disrupt the natural balance of bacteria in the gut, which plays a crucial role in overall health. Disruption of this balance can lead to secondary infections, such as Clostridium difficile, C. diff infection, and other health issues. Scientific evidence against antibiotics for acute bronchitis. A growing body of research underscores the ineffectiveness of antibiotics in treating acute bronchitis. Key studies include New England Journal of Medicine study. A landmark study published in this journal found that antibiotics had no significant impact on the duration or severity of acute bronchitis. The study concluded that antibiotics were no more effective than a placebo in treating symptoms, highlighting the need for alternative management strategies. Cochrane Review. A comprehensive review by the Cochrane Collaboration analyzed multiple studies on the use of antibiotics for acute bronchitis. The review found that antibiotics had a minimal effect on symptom relief and did not significantly alter the course of the illness. The review also noted that the potential harms of antibiotic use outweighed any marginal benefits. Other clinical trials. Various clinical trials have consistently demonstrated that antibiotics offer little to no benefit for acute bronchitis. These trials emphasize that supportive care is often more effective in managing symptoms and promoting recovery. Alternative approaches to managing bronchitis. Given the limitations of antibiotics for bronchitis, it is essential to consider alternative management strategies. Supportive care. For acute bronchitis, supportive care is often the most effective approach. This includes rest, allowing the body to recover and heal. Hydration, drinking plenty of fluids to help thin mucus and ease coughing. Over-the-counter medications, using medications such as cough suppressants or expectorants to manage symptoms. Humidification, using a humidifier or taking steamy showers to soothe irritated airways. Lifestyle modifications. For chronic bronchitis, lifestyle changes can have a significant impact. Smoking cessation. Avoiding tobacco smoke is crucial for managing chronic bronchitis and preventing disease progression. Avoiding irritants. Reducing exposure to environmental pollutants and irritants can help manage symptoms. Preventive measures. Vaccinations, such as the flu vaccine, can help prevent viral infections that may lead to bronchitis. Medical management. For individuals with chronic bronchitis, medications such as bronchodilators and corticosteroids may be prescribed to manage symptoms and improve lung function. The evidence clearly indicates that antibiotics are not a suitable treatment for acute bronchitis, particularly since most cases are caused by viral infections. The overuse of antibiotics poses significant risks, including antibiotic resistance, adverse effects, and disruption of gut microbiota. By focusing on supportive care and appropriate management strategies, we can better address bronchitis while preserving the effectiveness of antibiotics for bacterial infections. Changing the culture around antibiotic prescribing requires education for both healthcare providers and patients. Understanding the true nature of bronchitis and the limitations of antibiotics is crucial for making informed decisions about treatment. By adopting a more nuanced approach to managing bronchitis, we can improve patient outcomes and contribute to the broader effort to combat antibiotic resistance. Thank you for exploring this important topic. If you have any thoughts or questions, please feel free to share them. For more information on respiratory health, check out our video on natural remedies for coughs and other related content. Also, click on the video to your right, and the one below is what YouTube thinks you should watch.